For somebody that is not aware, would be surprised to hear that we weren't having what was just announced for cancer reporting in place before. I would like you to highlight why this is really, really important.
I don't think that it is so unusual for cancer or other non-communicable diseases to be notifiable. A notifiable disease typically by definition means one that presents a public health hazard and should be reported to the government authorities so that it can be curtailed from becoming a pandemic. The move by Nigeria in declaring it a notifiable disease, most of the other notifiable diseases are infectious diseases, and I think if my statistics is correct, is about the 24th, 25th to be declared. And like I said, they are all infectious diseases. So the move by the government or the Federal Ministry of Health in particular to make it notifiable is actually an unusual one. I do not believe there are many African low middle income or even high income countries that require you to notify cancer. Or of any sort. Working hand in hand with that declaration by the Honorable Minister of State for Health is the efforts of the whole health sector that is responsible, his ministry, the agency, NICRAT, to make cancer registration more effective. So by strengthening, reorganizing, and retraining our cancer registration system, it's easier for us to make the notifications. All in all, what that does is it strengthens our data. It gives us more reliable data about what the actual situation in cancer is, whatever type of cancer. And that is the ultimate aim of having these notifications. So I think that the move is actually one that is unusual, but very helpful in terms of getting better data for the country. There is a process to make the disease notifiable, and the Ministry of Health has gone through that. For us, it's something that we applauded because, like I explained, of the impact. And also, hand in hand with that is the registry strengthening. There have been a lot of fragmented efforts over the years to have cancer registration more effectively done in Nigeria, including some that we made in states like Kebbi by setting up our own registration system. But our data is not being captured by the agency that is responsible for global data under WHO, which is IAC. And the IAC was not capturing all these bits of data around. At the time, they explained it to me that it doesn't really matter as long as they had a good picture of what was happening, they could calculate and extrapolate the rest based on our population and other demographic characteristics. But what they realized later is that aside from the fact that Nigeria is a high population country, and we should, there are about 30, 20, 25 cancer registries currently in no, 33 cancer registries in Nigeria. But they were taking data from only four, and that was not enough. When you say four, you would think that, okay, maybe just within this area. Definitely that's what's happening. The data in Abuja will be reporting Abuja and environs and some patients that come for treatment in that hospital. Similarly, the one in Ekiti, I think Ekiti was the worst representation, sorry, because it's a small state, it's in a corner, it's not easily accessible. So the data you'll be getting there will reflect the Ekiti population mostly, who you cannot compare in so many ways in terms of their characteristics, their lifestyle, and of course their disease pattern to those that are in the opposite end in Kebbi. And so, bearing that in mind, we do need to have better inputs from all corners of Nigeria to reflect the diversity and the numbers of our population. So that is what they first did, to bring all the cancer registries under one umbrella, and then to strengthen them with training and all the equipment that they need, the computer systems, the software, and in collaboration with IAC and the African Cancer Network of Cancer Registries Network.
Thank you very much for that explanation. Something that I would also want us to talk about is we know that we still have a significant proportion of the population that everybody relies on private sector. So what is the reality of integrating the data or the people that are also as going to them for services, capturing them in this new dispensation?
Well, it comes with a registry. It doesn't matter whether they're in the private sector. The whole registration system can be hospital based or population based. And so the task of the hospital based ones is to go out into the population and capture data from other health centers, which includes private health centers. So if you're in Abuja, you are expected to go to the facilities that you're expected to have a map, first of all, that pinpoints the facilities that do cancer diagnosis. And it is from that they work very closely with the pathologists, who are the ones that do the actual tissue diagnosis of cancer. So it's from that they will get the data that they need. And so the private sector is carried along into this, and they are supposed to feed their own data as well into the central registry. And of course, the population one is also the opposite, which brings me to some of the issues that they often complain about, mainly based around access, transportation. You will see a good data officer that is very good at the whole software system and knows what to do, but he's hindered. He's not able to go into the community to get the data, go into the hospitals around him even to get the data that he needs. Because when I say transportation, I don't just mean, and that is also an issue, fueling the car itself, somebody that will drive him or accompany him, a handheld device that is going to be able to capture all this on. Look at me in my plush office with all the service I have in the capital of the country. Look how long it took me to join this interview. So imagine those that are working in government hospitals, they have that problem, and then also access in terms of geographical location. Again, the population and the geography of Nigeria comes into play here. We have unbelievably hard to reach areas. Unmotorable, some places you have to go by canoe, you have to ride on horseback, and that's why immunization coverage can be a problem. And it's not just Nigeria, a lot of African countries. There is no bridge to cross here and so on. So that becomes very difficult. But as we get more aware, as we get more technological, it's easier for all those things to be overcome.
Yes, thank you very much. And I think you are coming to an aspect I also want your thoughts on, which is driving attention and improving the response to cancer and non-communicable diseases like we currently do for infectious diseases. Even though we talk about accessibility, even though we talk about roads, we still know that immunization will still get to anybody in any part of the country. What is your suggestion regarding how to drive more attention like we currently shift to infectious diseases for cancer responses? So what are your thoughts on this?
Well, I think it's ramping up awareness and education more, and the reality of the situation, amplifying what is actually going on and telling the story of cancer patients and the hurdles that they go through. Um, Not just the patients, but their families as well. So letting governments and community gatekeepers be aware of exactly what cancer is as opposed to an infectious disease. You are quite correct. There is this mindset that, oh, cancer is a rich man's disease. Yes, because you need a lot of funding to diagnose it and to treat it, much more than you need for malaria, for instance. But the damage that it causes is just as widespread. By the time you count one person with cancer, the economic impact is that of 10, 20 with malaria to treat, or to even to just diagnose. So those the key thing really is working with the stakeholders, the community stakeholders at all levels of the country, from the local government to state level to federal level, and focusing our efforts on all those levels so that we can really pass the message, and getting a lot of the governmental efforts and non-governmental to bear that in mind. So the more we're able to educate about what cancer really is, the more we'll find that the trajectory improves. There's a paradigm shift from when I started. We started this work about 17 years ago. From when we started till today, there's a huge amount of difference in the type of responses that we get, and we're measuring this as we go along. The awareness and what the people understand to be cancer. And I want to finally emphasize the importance of our institutions in Africa, in Nigeria. Institutions can mean governments, it can mean non-governments, partners, but we also have our own homegrown institutions of the traditional and religious rulers in every aspect. So carrying them every part of the country, carrying them along is very important. I was listening to a story the other day about the problems that they had with HPV vaccination in one particular state, Imo State, with the first round. So the second round, they went to the to sensitize the Catholic, the churches, and so on. And apparently, it has a very high concentration of Catholics, and so they had not previously done that effort. By the time they sat down and enlightened, sensitized the Catholic priests, the second round was much easier due to that effort. So typically, we will just train the healthcare workers. This is HPV, this is what it does, these are the people you need to give. And even when we have community outreaches, we have a town hall meeting, maybe we just invite the head of the Catholic Church in the state and so on. But actually calling all the priests one by one and making sure you have a meeting, a training focused on them alone made a huge amount of difference.
I'm curious to know, do you think this is sustainable, that we have to go this way for every health initiative, for every health intervention that we are going to? And is this
But
also
we're
sustainable?
it is sustainable. We're doing it in a way. It doesn't take much these days, to have a town hall meeting. Yes, other problems will come from there, or other acts will arise from there. The priest will tell you they need to go to their parish, they need to tell everybody, and so on, and they need this transportation always comes up. And it is sustainable with more with the effort and realization that this is the impact it's going to have. And over time, then we'll get into an easy circle whereby we can even include health messaging in the curricula of these people when they are training, of our students, of our religious leaders, when our traditional leaders have meetings. It's very sustainable. It's about having the passion, about having the focus, and knowing the value add that it's going to bring. And it does have a lot of value add.
Yes, and I think I'm also curious to know, we've seen a lot of recent development. We had the First Ladies event
Yes.
recently, and we also have individuals like you playing more active roles, not just within Nigeria, but beyond Nigeria, internationally, as far as cancer is concerned. So what is driving this current what could be like a paradigm shift in terms of bringing attention to cancer issues in Nigeria, and what can be done to sustain the momentum?
Well, we need more champions. We need all the first ladies. Out of all the African first ladies, the meeting you refer to, maybe 10 came to the meeting in Nigeria. Next time they're having the meeting somewhere else, we want to see 20, 30. Maybe the one a few years ago in Burkina Faso, there were about 6 of them. So the more we talk about it, the more people will get on board, and the more the structure of the organization is more structured and more funded, then we'll be able to get the attention of people to know that it's not just coming to talk, we're actually going to do something about it. Then the need for it. Hardly will you find anybody that will not tell you one person within 6 degrees of separation from him has had cancer or is battling cancer. It may be your sister's friend. It could be your sister. It could be your co-worker or your co-worker's, parents or neighbor or something. There's always somebody around. And the more people realize that and understand that this is not one spiritual disease that there's nothing known about. There are lots of cancers that are curable. There are cancers that we can eliminate now. So with that message, driving the key messaging on what needs to be done, and at the same time, that is the low-hanging fruits. The higher end is provision of the structures that you need to diagnose, that you need to treat it, which primarily is a government responsibility. Of course, private sector is involved, but making it accessible, providing health insurance cover for even the poorest of the poor so that they can get some treatment. And there have been efforts all along those lines globally, not just in Nigeria. You find this fund is starting access programs. Even the pharmaceutical companies themselves are being more responsible on licensing some drugs and making it, free for anybody to manufacture. These are all positive steps that make people come on board and feel that, yes, we're doing something and we can do more. The tools for us to do more is there if we jump on it.
Why did you choose cancer as something, as an initiative, as a cause, and to fully embark on? What was the motivation?
For me, it was the need around me. I was seeing patients, pediatric patients, and they will come to the hospital with their mothers, mostly in our environments, mothers that bring their children to hospital. And the mothers will have one health issue around the private area, like the breast, that they don't want to show another man. And doesn't matter that I'm a pediatrician, they will ask me questions. I have a lump in my breast, or I'm bleeding abnormally, and the need. Then I started finding out that they didn't even know what this lump was all about. So we started going into educating and creating awareness, screening, telling them what they should do, get an ultrasound, get a mammogram, navigating them through the cancer spectrum. And then it had to become formal. And the more we got into it, the deeper we got. Because if you tell a woman, go and do a test, or okay, I will do tests for 10 women today, 100 tomorrow, you will pick a lump. They will come back to you and say, okay, what do I do about the lump? So you provide supports for that lump. The lump supports that you are providing, there's only so much that we can raise funds. We raise funds to provide support, another pillar of the foundation. But there's only so much that we can do. And so we need governments to give us insurance coverage. So we start advocating to governments and other policymakers to have a cancer health fund, to have insurance coverage, to provide more drugs. We start working with the pharmaceutical industry to do more. I start looking beyond the shores of Nigeria to find partnerships that are going to help us in low middle income countries. I want to see how it's done in Chicago. So I go to ASCO and hear about all the new cutting edge treatments and so on. So it just grows. It's a continuous growth effort. I joined the UICC. At the time, there were hardly any Africans involved. We have a lot more members now, and that gives me a global platform to be able to interact with persons from all over the world to improve cancer control in Nigeria.
So, second to last question: what are the quick wins that you think Nigeria can still record
Really
in
last question.
improving? Okay,
Let
what are
me,
the quick wins that you think Nigeria can achieve in it, that we can still achieve? And what are your last remarks as we wrap up?
Well, I think there's a lot of effort. The quick ways would be to focus on the structures that we have on ground and strengthen them, ensure that cancer diagnosis and treatment is inculcated into our primary healthcare system. That would really help. We have a very large, wide network of primary healthcare centers. If we can train the people manning it, the healthcare providers, to have some cancer training, then we'll be able to at least cover a significant proportion of the population. Work more with civil society, community-based ones especially. Again, that's another existing structure, amplifying patient voices and, having partnerships. Patient voices is so key, especially those that have been able to overcome to a reasonable extent. My last thought is cancer is universal. It's a problem. It's a universal problem. And it's a problem that we have to bring the solution from all parts to build sustainable partnerships and, bonds that will help us to come to the end of it. It is not both in country, out of continent. It's not a government only effort. It's an effort that everybody has to come on board, no matter how little the contribution is. The exponential effect that it's going to have is a lot. So by educating one woman, you can potentially educate the whole area she lives in, her family, her children, and so on. And it builds up like that. So I want to call everybody should be involved to make it controllable to an extent.